Hi, my name is Adam Perella, and this is my presentation on cultural diversity in health and health-seeking behaviors. People of Appalachian heritage. The Appalachian Mountain System is a 250,000 square mile region that extends from the northeast United States to northern Mississippi. Valleys around the Appalachians are around 2,000 feet or more in elevation, giving the people of the Appalachian region an isolated lifestyle very separate from the rest of the United States. Most people live in small settlements. This is Clingman's Dome, which is the highest peak in the Appalachian Mountains with an elevation of 6,644 feet. Education of the Appalachian people. The main focus for children growing up is earning a living to support the family. This results in less children attending high school and even less attending college, where only 25% of Appalachian people attend college, whereas 50% of people attend college nationally. Because of a varied education level, as a healthcare provider, it is important to assess health literacy when working with people of Appalachian heritage. Communication. Appalachian people live by four major communication themes. 1. Avoiding aggression and assertiveness. 2. Not interfering with others' lives unless asked to do so. 3. Avoiding dominance over others. And 4. Avoiding arguments and seeking agreement. When talking with healthcare providers who are outsiders, they may speak without emotion, facial expressions, or gestures. It is important, as healthcare providers, that their culture is taken into consideration before assuming or incorrectly treating people of this background. Family roles and organization. Although the culture is becoming more egalitarian with more opportunities for women to seek further education, men traditionally took care and provided for the family, whereas the woman would tend to the house and children. Older women are respected greatly in this culture, as they are traditionally responsible for preparing herbal remedies and folk medicines. Many families rely on the older woman for the preparation of these medicines, showing their maladaptive attitude towards Western medicines. Shown here is an Appalachian woman holding a woven basket of herbs. Family goals and priorities. Appalachian families are prideful of their independence. Family members often live very close to each other. The Appalachian Family Network can be a useful resource for the healthcare provider when health teaching and assistance with personalized care is needed for someone in the family. Shown here is a family taking a family picture in the 1960s in the Appalachian region. Diseases and health conditions. Poor housing conditions include inadequate sewage and plumbing, lack of refrigeration, and many environmental issues from industrial pollution. Occupations of farming, textile manufacturing, mining, furniture making, and timbering lead to diseases such as black lung, brown lung, emphysema, and tuberculosis. Other prominent diseases include hypochromic anemia, otitis media, cardiovascular diseases, female obesity, non-insulin dependent diabetes mellitus, and parasitic infections greater than the national norm. This is an example of the poor living conditions in the Appalachian region, as shown by the structure of this house. Diseases and health conditions continued. Children have a greater risk of dying from sudden infant death syndrome, congenital malformations, and infections. Childhood injuries such as burns, trauma, poisoning, child neglect, and abuse are higher than national average in the Appalachian region. As illustrated in these pictures, children are frequently neglected and live in very poor living conditions as shown by the hygiene and general upkeep of these children. Life and death. Childbearing is a family affair, and immediate and extended family often gather to assist the new mother with household chores. Healthcare providers providing pregnancy counseling to the family must be open to discuss cultural differences. When a family experiences death, they often receive several days off from work to mourn, and the extended family often comes to stay for a few days to prevent loneliness. Funerals often go on for many hours. Healthcare practices and cultural influence. Healthcare practices are influenced greatly by the beliefs that are derived from the concepts such as family, fatalism, traditionalism, self reliance, individualism, and the ethic of neutrality. In a survey of Appalachian people, 75% of people stated their health was God's will, clearly showing that their belief in God plays a major role in their health beliefs and behavior. Appalachian people have a strong belief in folk medicine as a traditional part of their culture. Cultural influences and ideologies. Because of the Appalachian culture described in this video, the people face many barriers in receiving the proper health care that they need. Barriers include lack of accessibility, affordability, adaptability, acceptability, appropriateness, and awareness. In addition to their culture impacting their healthcare, the rugged terrain and distance to available healthcare facilities also impact their decision on not getting the best care possible. My recommendation: the people of the Appalachian heritage do not have a well established healthcare system, but they could improve it by making it more accessible and affordable to the common family. They could be more accepting of Western medicine practices because, although herbal remedies can be effective sometimes, they are not nearly as effective as current medications. They could implement more regulations on occupational workplaces to cut down on the mass amounts of people getting diseases from the byproducts. The overall standard of living should be monitored and regulated to ensure children and future generations do not grow up in the current conditions that are leading to mass amounts of illnesses and disease. Thank you for watching my presentation on cultural diversity in health and health-seeking behaviors for the Appalachian people. I hope you enjoyed it.